someone you know snore loudly? If so, you may suffer from a sleep disorder called sleep apnea.
What is sleep apnea? Who does it affect? Do I have it? And how can it be treated?
Sleep apnea is a disorder. When sleeping, a person takes one or more pauses in breathing, or they have shallow breaths. Pauses can last seconds to minutes, and in some cases, 30 or more pauses in 1 hour. This causes poor quality of sleep due to oxygen starvation. And people suffering from sleep apnea don't even know that they have it, mostly because it occurs during sleep. So how do you tell that you suffer from sleep apnea? Some simple tips to self-diagnose yourself would be to answer any of these questions. Do you suffer from loud and constant snoring,
Restless sleep,
sleeplessness,
daytime sleepiness,
irritability?
and prolonged daytime confusion and fatigue after waking.
The most common form of sleep apnea is called obstructive sleep apnea.
This type of sleep apnea is the most common form of sleep apnea, and it occurs when the soft tissue in the back of your throat collapses during your sleep.
This is also what causes the loud snoring, and it's most common in people who are overweight or who have enlarged tonsils. Some common symptoms associated with obstructive sleep apnea include chronic snoring, sudden weight gain, depression, mood and memory problems, difficulty concentrating, high blood pressure, hypertension, heart diseases such as congestive heart failure, stroke, worsening of ADHD, and diabetes.
Obstructive sleep apnea affects 18 million Americans in all age groups, genders, and races. Women in menopause and after menopause are 3 times at risk for obstructive sleep apnea. It affects 2 to 3% of children from ages 2 to 8 on average, and also affects users of tobacco and alcohol. It's possibly genetic and affects those with a small jawbone, a large overbite, large tonsils, and a large neck.
The most common risk factors in males include being overweight, over the age of 40, having large neck sizes of 17 inches and over, having large tonsils, a large tongue or a small jawbone, those with large overbites, smoking and alcohol use, having high blood pressure or nasal obstructions, a family history of sleep apnea, and it is also most common in African Americans, Pacific Islanders, and Hispanics.
Risk factors in women include fatigue, obesity, high blood pressure, a neck size of 16 inches or larger, postmenopausal and menopausal women who are 3 times as likely to suffer of sleep apnea, and women gain more weight in the lower section of the airway, causing sleep apnea.
Some common symptoms of sleep apnea in children include abnormal sweating throughout their sleep, children noting that they have nightmares, also the pulling in of their chest indicating that they cannot breathe while they're sleeping, and also sleeping with their mouth constantly open and other abnormal sleeping positions. Risk factors for children also include obesity, loud snoring, daytime sleepiness, and irregular breathing while sleeping.
On occasion, parents should monitor their children's sleep to check for these symptoms. It is very common that sleep apnea is misdiagnosed. Patients complain about common symptoms like disrupted sleep, depression, fatigue, and insomnia. All of these symptoms are usually related to other sleep or dietary issues such as hypertension, anemia, and diabetes.
Another type of sleep apnea is called central sleep apnea. This type of sleep apnea is rare because it is caused by a defect in the brain, where the brain fails to send signals to the lungs to breathe when that person is sleeping. And due to this fact, some symptoms of central sleep apnea are only associated with this type of sleep apnea, such as difficulties when swallowing, numbness throughout the body, sudden change in voice, morning headaches. And central sleep apnea is often rare and difficult to diagnose because those suffering from it barely snore or do not snore at all.
So one method of treatment for sleep apnea is the CPAP machine. This is a CPAP machine and it just has an on and off button here. And you can adjust the pressures with this second button. The next step after you turn on your CPAP machine, you put the mask on your face. Once your CPAP machine is on your face, you just turn it on. Did you notice any difference once you had the mask on your face?
Yeah, it like forces air in your throat, and then it only lets you like exhale out of your nose, so you're not like snoring or choking on anything.
Types of sleep apnea, obstructive and central apnea, are treatable. The first step in treating sleep apnea is to have an overnight stay at a medical clinic for a sleep study where they will monitor your sleep. Here you will be properly diagnosed for your sleep apnea. If you do have sleep apnea, the most common treatment is a CPAP machine, which is also called a continuous positive airway pressure machine. Other methods of treatment include dental appliances, lifestyle changes, and in severe cases, surgery.